Right. So, good morning or good afternoon or good evening. Kung kailan nyo man ito papanoorin, pero most likely evening. Anyway, so yan. Ano naman tayo ulit sa ating abnormal psychology lectures. No? So, last time we talked about kumbaga, the definition of being abnormal. No? What does it mean to be abnormal? Or hindi naman abnormal. What does it mean to have abnormal behavior? So we've established kung ano nga yung mga criteria, no? And yun nga, yung 4Ds, yung dysfunction, deviant, ano ba ba? Dysfunction, deviant, dangerous, tsaka meron tayong distress or impairment, no? So yun yung abnormal behavior. Alam na natin kung ano yung characteristics ng isang abnormal behavior. So now, ang pag-uusapan naman natin would be sino ba, no? Sino ba yung nagda-diagnose or nag-assess kung sino yung mga merong mga disorder. And to put it more broadly, ano nga ba yung kumbaga sino yung nagda-diagnose, and kung syempre kung merong sino, merong isang sistema yan, no? Merong isang system of knowledge or system of information on how to describe or how to explain yung mga psychological disorders. And this systematic study, no, systematic body of knowledge about abnormal behavior is what we call psychopathology. So psychopathology is the systematic study of psychological disorders. So it came from the word pathology, no? Kung familiar kayo sa mga terms sa medicine, pag sinabing pathology is akin to a disease, no? Pag may pathology, no, brain pathology, there's something wrong. Ngayon, parang isasama if there's something wrong, and then kumbaga yung pathology, if it means something wrong or it means like a disease, then lalagay natin yung psych or psychology, so psychopathology, then we are talking about psychological disorders. So that's how you familiarize yourselves with the terms. Always make it to a point na you look for the etymology, no, ng word, kung saan nanggaling yung word, ano yung root word ng word, no? Root word ng word, para basta yung root words niya para mas maging familiar kayo, kasi there are times talaga na very malalim or mahahaba yung mga words na ginagamit natin. Pero if you can break it down to their most simple forms, you can actually grasp, no, yung meaning ng word. And syempre, pag familiar na kayo sa word, dahil di na siya masyadong bago, madali na nyo na lang siya matandaan. No need to repeat it again. Tapos pag nadapa kayo, makakalimutan nyo ulit. No? So you can see, I'm not a fan of memorizing stuff. I like to understand stuff. So that is my style. But again, style ko yun. Bala kayo kung anong gusto nyo gawin. No? So that is psychopathology. So, ang psychopathology, it's a system of systematic study. So, syempre kung systematic study yan, may mga nag-study dyan, di ba? And there are, actually, this is one of the confusions na meron sa mental health, sa psychopathology, no? Sino-sino nga ba yung mga involved sa study ng mga abnormal behavior? Well, technically speaking, dalawa lang talaga. No? Dalawa lang talaga yung parang kumbaga they are licensed, no, or they are trained to study these kinds of diseases of the mind. First of all, of course, yung mga psychiatrists. No? Psychiatrists are medical doctors, so MD sila, na trained, na naka-specialize sa mga psychiatric disorders. In the US, yun, marami mga psychiatrists doon. And in the US, usually mga psychiatrists, they are also trained to do psychotherapy. No? Maliban sa medications, they can also do psychotherapy. Here in the Philippines, technically meron ding training ang mga psychiatrist, no? And marami akong kilala ng mga psychiatrist na talagang nagsa-psychotherapy sila for both children and adults. But to be honest, in my experience, a lot of psychiatrists that I know are mainly focused on medications. Okay? Rare ko lang, siguro konti lang kilala ko mga psychiatrists, pero rare lang ako makakita talaga ng they also practice psychotherapy. But I hope marami naman. Di ako sure, okay? So, pero meron ako makakilala na nagsa-psychotherapy. So, as an MD, of course, medical doctor yung mga yan, no? They will undergo the training of a medical doctor. Usually, you need to have pre-medical degree, no? Yung BS Psychology is a pre-med degree, BS Bio, no? Basta yung mga may sciences, usually pwede silang mag-MD. And then after ng 4-year course na yun, they will go to medical school ba tawag doon, or medicine school, no? 4 years na naman. And then mag-aano sila, matatapos sila. If I'm not mistaken, magme-medical board exam sila after nilang medicine. So magiging silang general physician if that's if pumasa sila. And then they will do internship, parang training of 2 years. I think 2 years yun sa isang hospital ng specialization na gusto nila. So, isa sa mga specialization is yung psychiatry together with internal medicine, no? Ano ba, radiology ba? Di ko alam, di ako sure, no? Pero yun nga, psychiatry is one of them. One of the specialization. So mga medical doctor sila. And at sa medical doctor, their training is more on medicine talaga. And meron silang, kumbaga, pwede silang magreseta ng mga gamot, ng mga antidepressant, ng mga anti-anxiety, although parehas lang naman yan. And then yung mga anti-hallucination ba ang tawag doon? Basta yung mga yun, they can reseta. No? Pwede silang magreseta ng mga gamot in dealing with patients with severe psychiatric illnesses. So, yung mga psychiatric illnesses, usually sila yung mga talagang malalakas na yung symptoms, no? And very biological yung etiology or yung cause ng kanilang mga disorder. Usually, schizophrenia, no? Yung mga some forms of depression, bipolar, no? Usually need talaga ng mga ano yan, ng mga medications yan pag extreme na talaga yung kanilang mga symptoms. No? So that is those are psychiatrists are one of the practitioners of or one of the practitioners in the realm of clinical psychology. No? And then of course, papasok din dyan ng mga psychologists. So mga psychologists naman, ang minimum requirement at least in the Philippines is master's degree. No? Pwedeng master's in science, no? Basta in psychology, okay? Wala masyadong restriction kung ano man yung bachelor's degree nila, basta meron silang master's degree in psychology. So as of now, parang may proposal yung PAP board, no? Na parang i-streamline na nila yung mga master's program ng mga schools, no? Dati kasi may MS, may MA, may MP, no? Ngayon yata parang ang gusto nila is ano na lang, MA tsaka MP. MA is more focused on, hindi naman more focused, but meron siyang ano sa academics, no, sa research. And then yung MP naman is yung practitioner course, no, yung practitioner degree. So, but as of now, may MS, may MA, may MP. So MS is Master in Science, MA is Master of Arts, and then MP is Master in Psychology. And then of course, yung mga PhD din, PhD in Psychology, no? So, and then PsyD. So, anong pinagkaiba ng PhD sa PsyD? So, ang PhD, academic yung track na yan. Ibig sabihin talagang they can do teaching, kumbaga yung mga higher up ng ano yan, ng mga academia, yung mga nagiging program chair, yung mga nagiging head. No? And then ang PsyD naman on the other hand, mas focus sila sa practice. If I'm not mistaken, kailangan yata sa US, at least in the US, 900 hours of practice before yun yung pinaka OJT nila, no? I'm not sure if merong thesis, pero meron silang parang mga programs, no? hindi siya necessarily thesis, hindi siya dissertation, I mean. But akin to dissertation, although I'm not sure, but I'm very sure na ang PsyD is more on practicing side siya. PhD on the academic side siya. Okay? So either way, kahit ano pa yung makunin mo, basta may master's in psychology ka or may PhD or PsyD ka, you can become a psychologist here in the Philippines. So here in the Philippines, you need to pass the board exam. Okay? So pag hindi ka pa napagpasa ng board exam, of course, technically, you're not yet licensed. Okay? And then, yung psychiatrist and psychologist, technically speaking, sila lang ang parang they are the one that can diagnose and assess clinical patients. Now, baka may magtanong, how about yung mga guidance counselor and psychometricians? I've mentioned this in the video na, but guidance counselors and psychometricians are not really legally allowed, no, to assess or to diagnose patients. But they are also trained naman to detect, no? To detect those kinds of abnormal behaviors. Hindi lang sila legally speaking allowed no, to make such diagnosis. They know, kumbaga, yung mga guidance counselors natin and and some psychometricians, they know if a certain person is exhibiting abnormal behavior, no? But they cannot really do anything about it. They just know, and what they can do is to refer them. Okay? But that is not to say naman that guidance counselor and psychometricians are not in the field of psychopathology. It's just that technically speaking, hindi sila legally speaking, hindi sila licensed to diagnose. Okay? So, ang guidance counselor, they're more focused on the positive side ng development, mental health development, no? From normal to self-actualization. Yun ang kanilang focus. But psychologists din naman, they can also delve in counseling naman, no? Although meron din silang meron din silang license sa psychotherapy. May pagkakaibang psychotherapy at counseling, ha. So ang psychotherapy, there is behavioral change na gusto. Kumbaga merong gustong mabagong simptomas, no? Meanwhile, in counseling, it's more of a guidance, no? You guide the patient or you guide the client to solve his or her own problem without the guidance counselor actually stepping in. Kasi sa mga psychotherapy, mayroong konting stepping in na ginagawa ang mga psychologists depending on the case. No? Sa mga guidance counselors, more on guiding. Kaya nga guidance counselor, they guide the people to reach their maximum potential. If you will look at their law kasi ganun yung definition niya. Nothing about the psychopathology. No, mga normal problems ang kanilang focus. Psychometricians, on the other hand, they are technicians. Kumbaga, kung yung mga radiologists, meron silang mga radtech. No? Yung mga psychologists, meron silang mga psychometrician. Psychometrician are in charge in using the test. But that is not to say naman that psychologists are not equipped to do the testing. Kumbaga, assistant yung mga psychometricians. And the sad thing about psychometricians is that they're ang license natin it's hindi pwedeng kumbaga hindi pwedeng mag-exist yung kumbaga hindi pwedeng yung license lang natin na nakalagay sa isang psych report. Kailangan may kasama psychologist yan. No, kasi sa batas ganun yung sinasabi. Okay? So sa mga psychometricians, it can be BS, no? BS or AB, psychology. Usually, BS na ginagawa ng mga ibang mga tao kasi mas malaki yung opportunity, no? Mga nagbabago pa ng isip, baka gusto mag-mid or something. So, marami nagbe-BS. Pero pwede naman ng mga AB or Bachelor of Arts. Di ko alam bakit AB pero Bachelor of Arts. BA siya. Di ko alam. But anyway, yun. Guidance counselor and psychometricians, although they are technically not allowed to do diagnosis and assessment for clinical patients, they can still detect. No? They can still detect people with abnormal behavior. And there are some guidance counselors naman na also psychologists, no, RGC and RSI sila. So if that is the case, no problem. No, they can do psychotherapy and clinical assessment. Meanwhile, sa mga psychometricians, no, I myself is a psychometrician pa lang ang license ko. But yun nga, I'm done with my coursework in masters, and then I am meron kumbaga, thesis na ako niyan next year ko na siguro i-enroll dahil pahinga muna ako. But yun nga, I'm also training. No? I'm a psychologist in training, kumbaga. Hindi ako psychologist, pero I'm psychologist in training because I was under the supervision of a psychologist, no? May PhD, for more than a year na. So, I do kumbaga yung mga assessment na ginagawa ko technically naka-assign si psychologist but I am the one who is doing that, no? Parang ini-improve ng psychologist yung ginagawa ko, kaya nga training, di ba? So kung ganoon yung case, kung meron naman supervision ng mga psychologist, no, kung may supervision ng psychologist yung guidance counselor and psychometricians in doing their assessment or psychotherapy, wala namang problema. Kumbaga, it's all in the psychologist's hands naman. Kumbaga, yung blame, yung responsibility, psychologist yan. Okay? So, that's the science of psychopathology and who are involved. Okay? So, I hope this is clear. No? Medyo madami yung mga niyan eh. Sa guidance counselor, yung MA pala is MAGC, Masters of Arts in Guidance and Counseling. So, ayun. Okay? Uh, if you are serious about practicing psychology, I recommend you to choose one, psychologist or guidance counselor, because psychometricians, it's the end of the line, no? Kung di ka mag-guidance counselor, magsa-psychologist, hindi mo magagamit na maayos yung ano mo, yung license kasi it's very limited. Kumbaga, walang career progression sa psychometrician. Ang career progression ng psychometrician is to either go psychologist or guidance counselor. Okay? Ngayon, paano mo malalaman kung guidance counselor ba ang gusto mo or psychologist? Think about your theories of personality. Kanino ka mas comfortable? Mas comfortable ka ba kay Rogers or mas comfortable ka kina Freud? Kung mas comfortable ka kina Freud, I mean, mas comfortable, di mo naman ibig sabihin na sinasamba mo si Freud. No? Ibig sabihin, you agree to some points in psychodynamic theories. Eh, most likely baka psychologist ang para sa'yo. Ngayon, kung more on Rogers ka, no? More on hindi naman, more on humanistic perspective, it is a good sign na pang guidance counselor yung preference. Okay? So, yan. So, I hope this is clear. Now, ang mga ano natin, ang mga practitioners natin, they are not only practitioners but they are also scientists. What does this mean? As I've mentioned kanina, may academic track and then may practitioner track, di ba? Pero ideally speaking, dapat kahit practitioner ka, dapat nag-research ka pa din. And kahit researcher ka or academic track ka, mas ideal if nagpa-practice ka pa din, no? Kasi we are in the period of our time, no, of our profession na dapat science back. Kumbaga, scientific lahat ng mga approaches natin. Hindi na nag-move on na tayo sa pagiging too much theoretical. We need results. Okay? Many mental health professionals take scientific approach to their clinical work and therefore are called scientist practitioner. Usually yun nga, ginagamitan natin ng mga scientist, mga researcher approved na mga methods. Kasi kung magiging mas stuck lang tayo sa mga sinaunang approaches, medyo maraming problema ang mangyayari. Yung ang nakwento ko nung minsan sa mga students ko is yung may isang experience kami na parang isang practitioner na gumagamit pa rin ng flooding, no? And flooding, yung flooding kasi basically if someone has a phobia, para mawala yung phobia niya is if-flood mo yung stimulus na takot siya. So for example, takot siya sa dal, bigyan mo ng sandamakmak na dal ng isang biglaan, isang bagsakan. Tapos pag na-realize niya daw, theoretically, na wala naman daw problem kahit na-flood siya, magagaling daw siya sa phobia niya. In paper, it might work. Actually, hindi rin. Pero in paper, it might work. But in reality, it doesn't work. It causes more harm pa nga to the client. And if a practitioner is not updated with that kind of information, of course, magkakaroon siya ng harming effect sa kanyang client. So, it is better, no, for practitioners to update themselves in scientific advancement in our field. No? And so, as a practitioner, we consume scientific studies. And also, as we practice, no, pwede naman gumawa ng research. And yung mentor ko, he did just that. No? Although hindi namin natapos dahil nga may mga nangyari na hindi maganda. Yun nga, he died just recently. So, hindi namin natapos yung mga binabalak naming research about the clients. No? But anyway, so yun yung ano kasi, yung ideal kasi. Yun yung ideal na ginagawa. We are practicing but at the same time we do research, no? And it's also the same naman dapat sa mga researchers, dapat nagpa-practice din sila. I have this ano kasi na parang may mga times na kapag more on research na lang. Kasi research is, kahit may results yan, it's purely theoretical pa rin. And researches, especially yung mga quantitative researches, meron silang mga limitations. And in therapy, psychotherapy, sometimes research doesn't really, kumbaga may mga special kinds of people na some treatments that does not work on them, but some treatments that are scientifically not approved or scientifically questionable. Hindi naman questionable, yung parang wala pa masyadong research na ginagawa, nag-work sa kanila. And there, I don't know, no, but there's some researchers na parang very adamant na parang dapat ang lahat na ginagamit ng mga practitioners dapat mga matataas ang rating sa ano sa research, no? For example, CBT. While I agree with them kasi CBT is a good therapy. But the thing is, if you do practice, no, yun nga, I told you that yung boss ko, my late boss, was uh, was giving us clients, no, under supervision niya naman. And I found out that there are some clients that are not responding well to CBT. In fact, they are very offended with CBT because they know what is happening. No, especially yung mga smart na yung mga smart na patients. Kasi CBT, you're doing Socratic questioning, you're doing refuting, ganun, no? Eh, paano kung matalino yan, napag-isipan niya na lahat? And the reason kung bakit siya nag-depress is because lagi niyang pinag-iisipan lahat. Hindi niya inaalaw yung sarili niya na i-feel. Do you think CBT will be effective? I guess not, no? And if you're not practicing, no, for pag pure researcher ka lang, yun yung ginagawa mo, parang ay hindi scientifically approved yung dapat mag CBT ka kasi ito yung ano. Eh, in fact, hindi pa naman pina-practice ng researcher na yun yung CBT. Ang ano, parang nagkakaroon ng limited perspective ng researcher kasi hindi niya napuput into practice yung mga nare-research niya. Kumbaga, it's still a theory. And in practice, sometimes theory does not really make sense because human mind is very complicated. So what I mean is, hindi naman, kumbaga, hindi tama na researcher ka lang, no? Hindi rin tama na practitioner ka lang. Dapat both ka. Para kumbaga, meron kang advantage ng pagiging researcher and advantage ng pagiging practitioner. Advantage ng researcher meaning you know the research, you know the results, no? Kumbaga theoretically speaking, ito yung nagwo-work. And at the same time, as a practitioner, you will know that the theory has some limitations, so therefore parang nagkakaroon ng compromise. Okay, so it is better to become a scientist practitioner than being just a researcher or being just a practitioner because they have their own limitations. Okay? So, in psychology, you have to be well-rounded talaga. Hindi ka pwede mag-all-in sa isa lang. Okay? So, I hope that's clear. Next would be, now that we know, no, kung sino yung mga nag-research, sino yung mga nag-aaral, sino yung nagpa-practice sa ating field sa clinical psychology, i-discuss na natin kung paano or kung ano ba yung mga system nila. No? Ano ba yung system ng psychopathology na meron tayo. So, in describing abnormal behavior kasi we must first kumbaga ang approach natin dito is let us imagine a certain client entering or visiting, no, a clinic. So when a client visits a clinic, usually may problem yan, di ba? Parang pag pupunta lang tayo sa doktor, di ba, lagi tayo may complaint, di ba? Meron tayong chief complaint, kunyari, doc, masakit ang tiyan ko lagi, no? So sa mga psychological clinic, meron din ganun. Sabi niya, Doc, di ako makatulog. O kaya, Sir, di ako makatulog. Di po ako ganyan. So, that chief complaint or why the person came to the clinic is what we call presenting problem. No? So, usually, mga presenting problem, mga simptomas na yan. Yung mga simptomas na nararamdaman ng isang kliyente. Let's say, for example, di po ako makatulog, mabilis pong tumibok yung puso ko randomly. Wala naman po akong ginagawa, bigla na lang pong kumakabog yung puso ko. Tapos kakabahan ako, pinagpapawisan ako, hindi ko alam yung gagawin ko, tapos natatakot ako. So that is the presenting problem. And that presenting problem is a clinical description, no, of a certain disorder. So clinical description is represents the unique combination of behaviors, thoughts, and feelings that make up a specific disorder. So yun, yung kumakabog ang puso, kinakabahan, no, nag-aalala, tapos parang pinagpapawisan, no? Kung titignan natin, it's a general or clinical description of a person experiencing anxiety. Okay? So, most likely it's an anxiety disorder. Now, what kind of anxiety disorder? Di pa natin alam. So, clinical description is yung overall combination. So, I think kung ganito, if an experienced clinician would automatically say na, kumaga, intuition na yun eh. Most likely generalized anxiety disorder or panic disorder. Yung dalawa lang doon. Tapos canceling ba? Basta rule in, rule out, no? But anyway, advanced na yon siguro yung ruling in, ruling out diagnosis, it's something that is taught in a master class, no? Siguro di ko na muna i-include 'yon. Siguro pag natapos na natin yung mga basic, I can do some advanced stuff naman, di ba? Na I think will be useful. But anyway, yun nga, clinical description yan. Clinical description is yung combination ng mga symptoms na meron yung isang client. No? And then yun nga, pag most likely it's generalized anxiety disorder. Okay? So meron ng working hypothesis yung clinician. No? And then another way of or another thing about abnormal behavior na pwede nating tignan is ito mga minor lang to but it can be helpful, no? Prevalence. So prevalence is how many people experience the disorder in the population. So for example, in the Philippines, ilang percent ng mga Pilipino ang nakaka-experience ng generalized anxiety disorder? That is prevalence. And then incidence naman is how many cases occur during a given period. So for example, ang incidence ng anxiety on a normal situation, no, pre-pandemic, let's say for example, in a given year, meron tayong 100 cases, hindi, mga 10,000 din naman. Mga sabihin na natin, let's say for example, mga 10,000 incidents of generalized anxiety disorder. So that is incidence. Yung incidence, it can change from year to year, no, depende sa context. For example, pre-pandemic, mas konti siguro. Tapos nung nag-pandemic, maraming study na nagsasabi na biglang tumaas yung incidence ng mga disorders, ng mga psychological disorders, especially depression and anxiety. So that is incidence. Why do we have to know this? Well, as I've said, it's a minor thing, but parang ano din to parang statistics lang. Kumbaga, statistics siya. For the client themselves, it has little to no value. No? Parang wala namang value. Yung value niya lang is malalaman niya na meron din palang iba na nakakaranas ng nararanasan niya. But other than that, wala na. Pero sa mga clinicians, kumbaga kung alam nila yung prevalence, no, alam nila yung kumbaga mas mataas yung chance na itong taong to dahil mataas ang prevalence ng generalized anxiety disorder, no? Mataas ang chance na itong taong to is nakakaranas ng anxiety disorder, generalized anxiety disorder. And then incidence, it's more of a research thing, no? Parang meta na kasi yan, so overall na yan. So kumbaga, kung nakita nga natin na tumataas bigla yung incidence ng anxiety or generalized anxiety disorder, we have to do something about it, no? As practitioners. So yung mga ganun, yung mga ano siya, merong prevalence and incidence is more useful to the clinician more than the client themselves. Actually, most of them naman. And then of course, in describing abnormal behavior, we also check the course, no? Ano ba yung course? This is the pattern on how the disorder will progress. Meron tayong, yung course, ito yung parang, ano ba yung magiging ano niya? Kasi di ba, kunyari, ang course ng sipon. Yung course ng sipon is magkakasipon ka, tapos after 2 weeks, mawawala na. Di ba? Pero minsan, babalik pa siya. No? Lalo na kung na-stress ka or something. So that is the course of a cold, no? So ang mga abnormal behavior or mga psychological disorders, meron din silang ganun. Let's say, for example, ang schizophrenia. So, ang schizophrenia, usually kapag na-diagnose ang isang tao na may schizophrenia siya, hindi na aalis yun. Or kung aalis, madalang lang siyang mawala. No? Kung mawawala man siya, matagal na panahon bago siya mawala. So, ang tawag dun sa course na is yung chronic course. No? Parang chronic disease siya. Di ba yung mga chronic disease, yung parang forever nang meron ikaw? No? For example, dandruff. So, dandruff is a chronic disease because laging nandyan yan. Ang magagawa mo lang is mag-head and shoulders ka para mawala yung symptoms. Pero nandyan at nandyan yan. So schizophrenia is also like that. So it has a chronic course. No? And then there are also like bipolar and depression na episodic yung course. Ano ibig sabihin ng episodic? Kumbaga nangyayari siya at one point in our life, no? And then after ilang months or after ilang weeks, no? After doing some therapy, parang mawawala siya, pero eventually babalik din siya. So, ang tawag din is episodic course. I cannot think of, siguro yung mga ano ba yung lasso sa Tagalog? Singaw. So, yung singaw, ano yan, episodic yan. Kumbaga, minsan lalabas siya, no? Tapos after ilang days, after ilang weeks, no? Pwede mong lagyan ng medication, pwedeng hindi, and then mawawala siya. And then eventually babalik na naman, di ba? So episodic yung course niya. So depression is like that. Yung depression, hindi siya chronic per se kasi mawawala naman siya with treatment or sometimes without treatment. But it will eventually come back when the right circumstances are there, no? Ano yung right circumstances? Of course, if you are stressed, no, marami kang pinagdadaanan, o kaya naman nagdumaan ka sa grief or something, baka babalik yan, no? Episodic yung course na tawag doon. And then meron din tayong tinatawag na time limited course. So in time limited course, para siyang time limited lang, parang one time lang mangyayari sa iyo. And then, hindi na ulit mangyayari. Or kung mangyayari man, sobrang tagal. Okay? So, parang siguro, kapag nasugat ka, no? One time lang mangyayari yung sugat, tapos maghihilom din yan. Pero matagal bago ka masugat unless clumsy ka na tao, di ba? So, may mga psychological disorders na gano'n. Yung brief psychotic disorder, usually ganun yung nangyayari dyan. Yung brief psychotic disorder is parang magkakaroon ng skits for 1 day or 2 days, ganyan, no? So, time-limited course. Although, madalang lang yung mga na ganyan. Usually, chronic and episodic yung mga psychological disorders. And then, in terms of course, no? And then, meron din tayong tinatawag na onset, no? How the disorder develops. Yung course is yung progress niya, no? Kung gaano kahaba ka magkakaroon ng ganun or kung babalik ba or hindi. Yung onset naman is paano nag-emerge yung mga symptoms. Gaano kabilis or gaano kabagal. Meron tayong tinatawag na acute onset or biglaan, no? Biglaan nangyayari. Usually in depression, biglaan nangyayari yan. Hindi naman biglaan na one day depressed ka. Hindi naman. Kumbaga, unlike yung ibang mga diseases na insidious yung onset. Ibig sabihin, unti-unti. Some cases of schizophrenia is insidious yung onset niya. No? Hindi agad lumalabas. Even personality disorders. Hindi agad lumalabas ang personality disorders. In fact, ang isang requirement ng personality disorders is dapat 18 and above ka. No, sa mga iba, no, sa mga ibang mga personality disorders. So, yun yung onset. So, yung onset parang dito lang natin maano kung gaano nakatagal nag-uumpisa. Kasi yung mga gradual na onset kasi usually mapipigilan mo yan dahil insidious yung insidious onset. Mapipigilan mo siya if nakita mo agad yung signs, no? But pag hindi na, wala. Yung mga acute onset naman usually biglaan sila, no? But they can be manageable. Kasi nga biglaan, kumbaga yung mga biglaan kasi 'di ba, yun yung mas madaling remedyohan, no? Kasi kumbaga mas plastic 'yon. Yung insidious kasi nagse-set siya. Kumbaga parang semento yan na natutuyo. And then pag natuyo na yung semento, wala na. Yung yung acute onset parang parang glue yan na parang didikit tapos pwede mong tanggalin naman agad, no? So that's how onset works. So, and then knowing the course, knowing the pattern, and then knowing the onset, of course, we can anticipate kung ano mangyayari dun sa isang disorder. So, ang tawag dun sa anticipation of the anticipated course, no, ano mangyayari in the end dun sa disorder is tinatawag nating prognosis. So, ang prognosis, it can be good or be guarded. Ang ibig sabihin ng good prognosis, ibig sabihin most likely itong taong to is masasurvive niya yung disorder. Let's say for example, depression. Ang depression usually kung hindi naman masyadong severe, even some severe cases, prognosis is good, lalo na kung may treatment naman. But let's say for example, for other disorders like schizophrenia, the prognosis usually is guarded. Kasi talagang breakdown na yan, yung schizophrenia. So, yung prognosis, malalaman mo yan if you know the course and you know the onset of the disease. So, it's very important na malaman mo yung prognosis. Why? Kasi ang kliyente magtatanong yan, ano pong mangyayari sa akin, doc? Di ba? Parang sa mga, sa mga medical diseases lang, di ba? Kunyari, na-diagnose ka with something. Let's say, for example, cancer. No? Dahil yung cancer, alam natin yung onset niya, alam natin yung onset, alam natin yung course. So, yung doctor, meron siyang prognosis. Diba? Prognosis can be good. Ibig sabihin, if you do this therapy, if you do this surgery, you have a good prognosis. But there are some kinds of cancer na guarded talaga. Yung prognosis, especially sa mga late na na-discover. So, ganun din sa mga psychological disorders. Merong prognosis na good, merong prognosis na guarded. All depends on the disease and kung na-detect ba agad yung onset, and then of course kung yung disease-based chronic or episodic. Okay? And lastly is yung tinatawag nating etiology. So ang etiology is yung study of origins. So of course, maliban dun sa behavior mismo, di ba? Mag-curious tayo lagi. Saan nanggaling? Why? Diba? Ganun tayo lagi. Yung curiosity natin, so why? Diba? So mga abnormal behaviors, why did they come to fruition. Kumbaga, bakit merong psychological disorder itong taong to? So the study of origins has to do with the disorder begins what causes it and includes biological, psychological, and social dimensions. So ang mga abnormal behavior, at least in our modern perspective, we know that it has some biological, no? Ibig sabihin sa brain chemistry, sa neurons natin, nervous system, and even sa mga sakit, di ba? And then psychological dimension, kumbaga yung the way we think, the way we act, our personality, it can affect our psychological disorders, and then of course the social dimensions, yung relationships natin sa ibang tao. Kapag maganda yung mga relationship natin sa ibang tao, mas mababa yung chance natin magkaroon ng disorder. Pero pag hindi maganda, tumataas din yung chance natin magka-disorder. So, may mga disorder na nanggagaling sa society, no? Lalo na kung pag kunyari, for example, you got bullied, no? O kaya naman parang nagkaroon ka ng near-death experience with someone you know, no? Social yun. And then of course psychological din yun, di ba? Mga ganung mga causes. And yun nga, abnormal behavior is a complex behavior that has no one cause. Marami siya laging cause, and usually biological, psychological, and social dimensions. And studying the etiology, studying kung saan nanggaling yung disorder ng isang tao will help us in creating our treatment plan. Kumbaga, kung alam natin kung saan nanggaling yung sakit, alam natin kung anong pwede nating bigay na gamot or bigay na treatment sa isang tao. For example, colds. We know that colds are caused by viruses, no? So yung virus, usually, hindi mo naman kailangan ng, ng gamot dyan, lalo na kung colds na relatively weak virus lang. So, hayaan mo lang. Kasi alam mo yung cause eh. Paano kung yung disease mo is something like pneumonia, no? Kung alam mo kung saan nanggagaling yung pneumonia, pwede nating i-target yun. Kasi there are so many origins. Merong viral pneumonia, merong bacterial pneumonia, di ba? So, depende kung ano yung origin niya, pwede mong bigyan ng gamot. Antiviral ba or antibiotic? Diba? Ganun din sa disorders. Kung alam natin na more on biological yan, bigyan natin siya ng medication. Kung alam natin na more on psychological yan, bigyan natin siya psychotherapy. Kung alam natin na social dimension yan, itanggalin natin siya sa society. Hindi, joke lang. Tanggalin natin yung mga factors na sa society or i-address natin. For example, meron issues sa family. So, kausapin yung family. Diba? So, if we know the cause, then we know the treatment. So, that is abnormal behavior. So that's how we study or that's how we describe, no? That's how we kumbaga, that's how we study naman talaga the abnormal behavior. It's more of it's actually abnormal behavior, it's it's very complicated, no? Actually yung mga terms na to, they came from medical field, no? Hiniram sa medical field to. Kasi after all, yun nga, kung malalaman natin sa history natin sa psychopathology, talagang malaki influence ng psychiatrist or ng medical doctors in dealing with psychopathology. Okay? So, I hope it's clear. I hope mas naintindihan natin kung paano describe yung isang abnormal behavior. No? Hindi lang siya abnormal behavior na ganyan. Kailangan alam natin yung prevalence, incidence, yung course, yung onset, yung prognosis, and of course, yung causes or yung etiology. No? So that's how we study. No? That's how we describe abnormal behaviors or psychopathology. Okay, so I hope everything is clear. I hope mas na-gets ninyo kung paano nga ba natin pinag-aaralan yung mga abnormal behavior. And next meeting, we will discuss yung mga history, no? Kung paano tayo napunta sa kung anong meron tayo ngayon. Kasi before, it's not like this. It's not something good. But anyway, that's it for today, and see you next meeting on our next lesson. Bye-bye.